Hello and welcome everyone to our webinar presentation today titled Empowering Filipino Nurses Through PNAA. My name is Ron Hoppy. I have the pleasure of serving as CEO of Worldwide Health Staff Solutions, and it is my great pleasure to be joined today by the current president of PNAA, Marlon Soria. I'll more formally introduce Marlon in just a moment. Again, welcome everyone, and thank you for joining us from wherever in the world you may happen to be at the moment. As always, please, we always ask, please take a moment and in the chat section of your screen, please let us know where you are joining from. Also, please know that should you have any questions of Marlon, who will be our presenter today, please feel free to just jot those down also in the chat section of your screen. And towards the end of our time together today, we'll do our very best to respond to as many questions as we possibly can. The purpose of our presentation today is for you to gain a greater understanding of who PNAA is as an organization, the Philippine Nurses Association of America, to gain a deeper understanding of the breadth and the scope of the services, resources, and supports that they offer to Filipino nurses, but not just to Filipino nurses, to internationally educated nurses generally. Ali, if we could go to the next slide, please. So just a little bit by way of introduction about PNAA. The Philippine Nurses Association of America currently has 55 chapters in various locations around the country, very broad coverage. The PNAA was established in 1979, so right around 40 years ago, a little bit more. And their mission is here. I'm not going to read it all. I'm sure Marlon will be speaking to parts of this as part of his presentation. Next slide, please. We're bringing you this webinar presentation this evening as part of our partnership with PNAA. We are a proud partner and sponsor. We actively participate in several of the PNAA chapters and are certainly supportive of its mission and members. One of the things that we're excited to do is we at Worldwide Health Staff, we're sponsoring PNAA memberships. So whenever one of our internationally educated nurses arrives in the US, Worldwide Health Staff connects them with PNAA by helping to pay for their first year membership in the association. We've also had the great opportunity of participating in various events, membership events, community involvement, and this is consistent with our overall commitment to supporting the personal and professional growth of Filipino nurses. We are excited to be engaged in PNAA events, of which there are many, over the course of the year, and to participate and contribute at the national and regional level as part of our ongoing support. So with just that brief introduction, again, it is my great pleasure to be joined this evening by Marlon Garza Soria, President, PNAA. Marlon is an extremely busy person, booked solid and in demand, as they say. And so him taking time out of his very busy schedule to join us today is certainly greatly appreciated. Marlon, thank you. It's been a pleasure getting to know you over the last while and partnering with you in the various chapters. Thank you for joining us today. It's my pleasure to turn it over to you.
Great. Thank you, Ron, and Worldwide Health Staff. This is a great opportunity to be invited to come here and be able to present about the work that the Philippine Nurses Association of America is continuing to do, not only here in the United States, but globally as well. So I guess this is the first slide, not mine. Thanks, Ron, for creating this for me.
Yeah.
Just to
Well,
introduce.
it speaks for itself, Marlon, and it speaks to your many accomplishments, and we're certainly happy to share this with our guests as well.
Awesome. So yes, I am a nurse scientist and a magnet program director at Providence St. John's Health Center in Santa Monica, California. Also, still serving as a nurse in the U.S. Air Force Reserve. Actually, spent past 4 days this past weekend at a drill at March Air Reserve Base here in Southern California. Been president of the Philippine Nurses Association since last year, July of last year. And my term ends July of 2026. Yes, board certified and very much advocating for diversity, equity, inclusion, global health, nursing leadership. That's the crux of my work, particularly with PNAA. Uh, Next slide, please. So I created the slides from the president's report that I gave at our recent national convention at the General Assembly of the membership of the Philippine Nurses Association of America. And this is just a summary of not only what we've done in the past year, but what PNAA is continuing to do to contribute to the outcomes in healthcare and society. Next slide, please. Just a disclaimer. I'm not going to read the slide, but yes, I am coming here. I am the president of PNAA. I've mentioned all my affiliations, but whatever I say here this is entirely my own, my own opinion. Uh, does not imply endorsement or recommendation by any affiliated organization. Next slide, please. So we'll start with a brief history of PNAA. It's always good to look back before we look forward to the future. If there are Filipinos in the audience, you know the famous quote by our national hero, ang hindi marunong lumingon sa pinanggalingan. Those who don't know how to look back will not be able to move forward. So this is a look back. This is a map from 1979 when PNAA was founded. You can see the logo down on the lower right side of that slide. It has the year of the incorporation of PNAA. It was not called PNAA back then, but PNAA was a collection of 5 chapters: PNA Michigan, PNA Illinois, PNA New York, PNA New Jersey, and PNA California that got together to advocate for, if you look at the history, 2 nurses, Filipina Narciso and Leonora Perez, both from Michigan, Ann Arbor, Michigan, who who were in a lawsuit at that time. So we have gone a long way from 1979. So from those 5 initial chapters to the next slide, please. Ron mentioned 55. We actually have 57 chapters now.
Wow.
We were going to have 58, but we disaffiliated 1 chapter who's not able to keep up with their membership. We tried to save them for the longest time. So we're back to 57, with the latest chapter being in California. That's a PNA Bay Area. They were formerly PNA Northern California Stanford subchapter. And I'll talk more about that later. So you can see that we're present in about 30 states. There's a couple more states that we don't have official chapters, but any nurse from those states can join PNAA as a general member. Next slide, please. As I mentioned earlier, PNAA was founded in 1979. It was initially called the Federation of Philippine Nurses Association. So you can imagine those 5 organizations that predated the mother organization, right? Illinois, Michigan, New York, New Jersey, and Southern California got together because of those 2 nurses, because of a lawsuit. and then they were incorporated in New Jersey. A couple of years later, they changed their name and became the National Organization of Philippine Nurses Association in the United States. So just from the name itself, you could tell that it still is an organization of organizations. No individual memberships at that time. It was the chapters that comprised PNAA first. We officially took on the name PNAA, the Philippine Nurses Association of America, in New York in 1987. And then from there, just some key highlights in the PNAA's history. December 1996, we had our first collaborative international conference with the Philippine Nurses Association, so in Manila, Philippines. 1998, we launched a website. It's when I was reading this history, I couldn't help but just be proud of what we've done. Can you imagine 1998? We were talking about launching websites. If you're an organization without a website now, you must have, there must be something wrong with you. But this was not too long ago, 1998, and that was when we launched our website. I guess before then we were using Yellow Pages to find organizations.
Yeah,
Just
fax machines.
right, we had fax machines. Just amazing of how fast technology has moved us forward. And then June of 1999 in Washington, D.C., PNAA had the first national meeting with the National Coalition of Ethnic Minority Nursing Associations. And that's a group of 5 ethnic associations: the National Black Nurses Association, National Association of Hispanic Nurses, the National Association of Native American Indian Nurses, and National Association of Asian American Nurses, with PNAA being the 5th organization that comprised the National Coalition of Ethnic Minority Nursing Associations that's making waves right now, doing a lot of work with other national organizations here in the United States. Next slide, please. So as I mentioned, these are our regions and the number of chapters in each region. There are some states with just one PNAA chapter. There are other states with multiple PNAA chapters. So it really just depends on what the bylaws of the chapters are. I could tell you I live in California. I did say earlier that I work for Providence St. John's in Santa Monica, California. California alone has 9 chapters.
Mm.
And then New Jersey, a huge state with still the highest membership, has only one chapter with, I think, 8 or 9 sub chapters under the mother chapter. So different models in different states. That's why you can see Eastern region have 11 chapters in only 9 states, plus the District of Columbia. North Central region has 11 active chapters in 8 states. If you look at the Western region, that's a wider gap there. We have 16 chapters in only 6 states because there's a lot in California. Same thing with Texas, 19 chapters in only 5 states. Most of those chapters are in Texas. So it's just how the chapters played out and the bylaws of each of those chapters. Next slide, please. I just wanted to speak just for a brief moment on the mantra of my presidency. And I chose impact and influence. And then just a basic definition of impact. It's our ability to affect the thoughts, decisions, and behaviors of others. And I'm using this because PNAA as a membership organization, our goal is to affect the behaviors of our members, affect the behaviors of our key stakeholders through our advocacy, right, as nurses. Sorry, I was talking about influence that's affecting the behavior and decisions, and then impact is the measurable outcome of our influence, and that's a key strategy that I'm doing during the next, during my term, the 2 years that I'm on as president. Looking at the measurable effects and the results of us, our chapters, our organizations, and individually on healthcare and the society. Next slide, please. So, we are a professional Nursing Membership Association. And if you ask me what our priority is, our number one priority would be membership. Right? We are the Philippine Nurses Association of America, a membership association. If we don't do membership well, then we're not doing our job. So that is the number one priority, number one goal for the organization, is to look at our membership and try to increase that as much as we can. This report that you see here, membership numbers, that's as of June of this year, June of 2025. There was a dip in June, and that's because a lot of our memberships expire in June. Our memberships are on a rolling basis. You renew whenever you first signed up. And many of our members sign up in the month of June and July, right around our national convention. There was a slight dip, but we're not worried. We're not concerned that will go back up, especially in the next year where it will be an election year. And another big convention that we're all looking forward to in Colorado Springs, in Colorado. Some of our priorities are to overhaul our membership registration and renewal process. Ron did mention that Worldwide Health Staffing is helping with membership fees for the nurses that they bring in. We used to not have that in PNAA, but because of organizations and entities that have asked us to reconsider uh, how we get members, how we register our members. We started looking into that and trying to ease the way of our partners, so that they could bring in more members to PNAA. I know that some of you will be asking, so what's in it for me? Would I even want to become a member of PNAA? And then if I forget to get back to that, please someone ask a question at the end of the presentation. I don't want to preempt myself. I'll talk about that later. But we sincerely appreciate organizations and that help us increase our membership, because that means that we can expand our impact and our influence through more membership. We're looking at a committee reorganization, looking at chapter affairs. I've always said that the chapters are really, they're the face of PNAA in the community, right? We have the national organization and we do represent Filipino nurses at the national level. But if you look at the local level, there's a lot more impact at the local level through our chapters. So it is a priority for me and for the current executive board to make sure that our chapters are supported, and that's one of our key goals for the next key goals for the next at least remaining year during my presidency. We're looking at technology. We've had conferences for 46 years now. We just celebrated our 46th annual national convention in Detroit. We launched the use of Huva in San Diego in April of this year, and in July we used it again at the national convention. So that Huva app connects our members, especially those attending our conventions and conferences, with their sponsors. There's a better connection, better networking, plus the membership within each amongst each other, that the members are able to connect amongst each other better as well, by using the app for our conferences. And we also do have student membership. It's free membership for any undergrad nursing student. So if you do not have a nursing license yet, right, whether you're an undergrad for a associate's degree or a bachelor's degree, as long as you don't have a nursing license yet, you can join PNAA for free. You can just go to the PNAA website and sign up as a student member. I also created a think tank to make sure that student members are involved in creating what the PNAA experience will be for them. So if there are any students on this call, on this webinar, please let me know if you're interested. Sign up as a member first and let me know if you're interested so I can connect you with the membership committee to be part of the think tank. Next slide, please. These are just some of the other things that we're doing. Very big on communications. I always say that we can do a lot of great things, but if the world doesn't know what we're doing, then we cannot make that influence and make an impact. So we need to let the world know what we're doing. We have our social media presence very active. If you're on Facebook or LinkedIn or Instagram, we have our weekly newsletter in an email format that is sent out to all our members, outlining all the activities, not just of the national organization, but of our chapters as well. Uh, I'm very big on advocacy and supporting our legislative committee. I'm very proud to share that we have Jelani De Castro from Southern California, who's heading our legislative committee. She's very actively involved with the American Nurses Association in terms of our for our legislative committee, looking at position statements, our papers, anything politically that we can advocate for, especially or particularly if it's relates to healthcare or our patients or the profession. And then Sophia Aragon, the other name that you see there, she's a nurse. She was a mayor at Buren in Oregon or Washington, in Washington State. So this is a nurse who became a mayor in Washington State, also very actively involved with PNAA. So that's one of the benefits that I told you earlier that I'll be mentioning. When you join PNAA, you get access to these individuals. You attend their conferences, you meet them in person, you get to talk to them. If you have a desire to run for public office, we do have those individuals within our association that you can network with, and then you can ask to be your mentor. Uh, Also, first time that we've done for PNAA at our just recently concluded national convention in Detroit, we had a media response training. We have 15 of our members attend a media response training led by Barbara Glickstein, a very influential, famous, known nurse strategist, media strategist. So these 15 individuals will comprise the first cohort of our media response team in PNAA. If there are any issues, if CNN or Fox News would want to speak to PNAA, to a nurse, then I already have 15 names to send to them, right? Who can respond to these media requests, either uh, recorded, live, in person, or by email. But that's very important. Again, we need to get the word out there that PNAA exists and that PNAA is doing a great job. Next slide, please. I did mention PNA Bay Area. So this is a new model that we have implemented in the past year. Uh, Stanford University in California approached us and said that they wanted to establish a chapter. At that time, it was difficult for them to be a chapter because we have PNA Northern California as a chapter. So we incorporated them as a subchapter of PNA Northern California for about a year. And then after a year, they asked their mother chapter if they could break away and form their own chapter. And the mother chapter in Northern California gave them approval. So now Dr. Alisa Nguyen, she's a vice president, chief nursing officer at Stanford Healthcare, is the president, founding president of our 57th chapter, our newest chapter, Filipino Nurses Association of America Bay Area in San Francisco. They have over 300 members now,
Wow.
which is more than many of our chapters. And I gave Dr. Nguyen a challenge to actually to get more members than New Jersey. Remember earlier I said New Jersey has the most number of members at 600 or 700, and Dr. Nguyen, I think will take up that challenge and try to beat New Jersey and be the number one chapter in PNAA with the most members. Uh, I call them the disruptors. You know, it's a good thing. The disruptors in PNAA. So we'll see what happens in the next 12 months. But I'm very proud of the work that they have done at Stanford. Next slide, please. Some of our other modes, platforms for communication, we have Inside PNAA. That's a monthly newsletter. You can see two editions here, very colorful, lots of stories, many pages of stories of our members and our chapters doing the great work that they're doing in the community. And for those of you who are in academia, who are looking for scientific articles, we do have the JANPAR, or the Journal of Nursing Practice Applications and Reviews of Research. We try to put out two issues a year. And this is one of them, one of the most current issues, and that's a scientific journal that is peer reviewed by our, not only our members, but some experts in nursing science as well. Uh, Next slide, please. I mentioned the conferences. So wherever you are in the world, you're invited. You're welcome to attend our conferences. We just completed our 46th convention in Detroit. Uh, Along with that, we had our Internationally Educated Nurses Summit. That was a pre-conference that happened before the national convention. In October, we will have our Eastern Region Conference in Baltimore, Maryland. That's October 2nd to October 5th. And in January of 2026, if anyone here is from Manila, we will be hosting our Global Summit and International Nursing Conference in Manila at the Conrad Hotel next to the Mall of Asia. So we hope to see you there. That's going to be a big event. I heard that there's already a lot of members and individuals trying to book their rooms. So I am anticipating a sold out event for that. If you want to attend, make sure you register early. North Central Conference will be in Cleveland, Ohio in April, and then our 47th annual national convention will be in Colorado Springs in July of 2026. Next slide, please. Uh, I mentioned earlier we're a member of coalitions. We are creating a mentor, preceptor, speakers bureau. This is one of those value-added uh, services or initiatives that you can get from PNAA. If you are in school to become an advanced practice nurse, a nurse practitioner, if you want to become a dean of a school of nursing, if you want to become a chief nursing officer, we're creating that list for you. So you know who to call to ask them for mentorship. You can get that through PNAA. That's actively one of the works that we're doing right now. I mentioned the work of Gilani De Castro and the Legislative Committee working on position papers, press releases for some of the advocacy work, for any work related to healthcare legislation and legislation that impacts the nursing profession. Very actively involved with the Association of Nurses in Health Environment, ANHI. We have a climate change task force led by one of our regional vice presidents, Manelita Bong Dayon, also working on joint statements with them. One of the big collaborative projects we did with ANHI and some of the other agencies was related to the Los Angeles fires. By the way, I was affected by those fires, not personally, but I worked at an organization that was a block away from where the evacuation area was. So that was very real, very near and dear to me, the work that has been done by PNAA to support our nurses and colleagues here in Southern California. We're very active with the American Nurses Association. PNAA is an organizational affiliate of the American Nurses Association, and we are invited to their meeting twice a year. The president-elect, retired Colonel Bob Gahol, and myself will be going to Kansas City in November to attend an organizational affiliate meeting of the ANA at the Nursing Organizations Alliance Summit in November. So you can see that PNAA is very well embedded in all these associations and coalitions here in the United States. And one of the things that I am most proud of is the work of our community outreach. If you remember the typhoon last year, Typhoon Karina in the Philippines, severe flooding, we were able to collect a lot of money that we were able to send back to the Philippines. At that time, we were thinking of partnering with organizations, and the chair of the Community Outreach Committee and myself had a conversation, and I said, why do we have to look for other organizations? The Philippine Red Cross is a very trustworthy organization. They're already there. They already have the structure and the process to reach all these individuals affected by disaster. So why don't we reach out to them? And thankfully, Philippine Red Cross reached back out to us, and we were able to design this partnership with them where they will conduct their health caravans, which they already have, funded by PNAA to reach individuals. So with our donation last year, they gave us these outcomes where the money that we sent to them was able to reach 1,947 individuals through their health caravans that were sent post disasters. Next slide, please. Uh, when you attend PNAA events, you get to meet some of our members. Some of our members are very actively involved with other organizations. So it's all about the networking. If you want to grow your career, you will meet these individuals, very active individuals within our chapters and the national organization. So Cindy Fries is the Associate Executive Director for Clinical Affairs for the Society of Gastroenterology Nursing Association. That's another big organization here in the U.S. that she invited me to speak to them last year at their convention, and that's how this partnership started with PNAA. Very proud, Dr. Castillo from Florida, is the president elect of the National Council of State Boards of Nursing. So he will be president last year. So for all the Filipinos out there, Filipino will be heading the National Council of State Boards of Nursing here in the United States as of 2026. Dr. Christine Pabico is a senior director for the American Nurses Credentialing Center. If you've heard of hospitals that are magnet or pathway designated, Dr. Pabico has a lot to do with that, very actively involved she's currently president of the PNA Metro DC chapter, District of Columbia chapter. So that's how involved she is. Dr. Dan Lavinaria, another celebrity within our group, is the president of the Anesthesia Society, Philippine American Nursing Anesthetist, or Anesthesiologist Society. And Dr. Nelson Tuazon from Texas. I did not write an organization there because Dr. Tuazon is practically a member of every organization you can think of. So I didn't know which one to write, but he's actively involved with the American Nursing Association, the Academy of Nursing, the Med Surg Nursing Association, and then mentioned an organization, and Dr. Tuazon is a member. And these are individuals who, like I said, not only attends meetings, but will offer their services to be a mentor, to help with you with your career guidance. Next slide, please. uh, and other coalitions and representation. The Philippine Nurses Association of America was awarded a CIPRE award, and that's through the courts, where they gave us $300,000 divided equally amongst PNA of America, PNA of New Jersey, and PNA of New York. That's the money that we used to host the Internationally Educated Nurses Summit. And that money is to be used for any issues, toolkits, any initiatives related to internationally educated nurses. In April of 2025, we got additional funding, an additional $36,000 for each organization that we could use for those purposes. And because of those monies, as I already mentioned, we had our inaugural summit at the National Convention. Our practice committee is working with PNA and Dr. Zyrene Marsh from UC Davis in Sacramento to help PNA and then other organizations and institutions in the Philippines to uh, revisit the Philippine Nursing Act so that we could establish advanced practice nurses in the Philippines. So we're all in that effort. Obviously, because we are U.S. citizens, we cannot be doing the advocacy, but we're willing to provide the resources so that nurses in the Philippines can do the advocacy work and speak to the legislators in the Philippines. We can help provide with clinical rotations, preceptorships, partnering with NP Hub. That's an organization that can help pair our advanced practice students with advanced practice nurses here in the U.S. As that has become an issue recently, trying to find preceptors. So you can see that PNAA is always looking at ways to assist with day-to-day problems of our members. Uh, Next slide, please. And then just miscellaneous updates. We have a diversity, equity, inclusion, belonging, social justice task force doing work with a Palawan-based nonprofit organization. For those not in the Philippines, Palawan is an island in central Philippines. They're helping an organization looking at HIV stigma. Uh, we're looking at revisiting our awards, building our legacy awards. PNAA will be celebrating our 50th anniversary in 2029. Remember, I said earlier we were founded in 1979, so we will be celebrating 50 years in 4 years. And then we do have a work group who's looking at that to make sure that we're capturing all the impact of the organization. Dr. Jeanette Moreno, also here from Southern California, is working with the Alzheimer's Association. We have 12 PNAA chapters working with 12 Alzheimer's Association chapters in their local communities to increase awareness on Alzheimer's disease, signs and symptoms, and treatment. Okay, next slide, please. Camp Aruga, that is a unique leadership development training that we started during the term of Dr. Gloria Beriones. Most of the leadership development conferences or institutes that you probably have heard of involve classroom work. Camp Aruga, as the term implies, we actually go outdoors. This is a camping style leadership boot camp where we go outdoors and spend 3 days with each other in the four regions. One of my favorite camps was held in San Francisco at a military barracks. So there's a big room that can accommodate about 80 individuals, bunk beds, top bunk, low bunk beds, where we all stayed in one room. It doesn't matter your gender, female, male. We were sharing a bathroom with the president-elect, Dr. Gloria Beriones, and then our young members. But that's how we built camaraderie amongst our chapters. Plus, you get to learn leadership skills in those trainings as well. Some of the rules are no PowerPoints. You have to be able to deliver the content without using PowerPoint slides. So there's a lot of hands-on activity. There's a lot of running outdoors, a lot of group work. And that has been very successful. And that's one of the benefits of becoming a member of PNAA is you can attend the Camp Aruga Leadership Boot Camp. The next one will be in Oregon in October. So that will be the Western region hosting it in Oregon in October. Next slide, please. We have our leadership development program. This is more of a project management and leadership development where we train members to be leaders of their chapters. The most recent group cohort graduated in Detroit. 42 of the 50 fellows who applied or who were accepted to the program actually completed the program. It's very rigorous. You can see that we have 8 dropouts. That would have been more. But we have great mentors who will help you finish the program and then help you become a leader within your chapter. Next slide, please. Our Kabalikat Emotional Wellness Program, chaired by one of our regional vice presidents, Dr. Mauricio. So this started in 2020, the middle of COVID, where we realized all the mental health issues that nurses were having, particularly our own nurses. Again, we're the Philippine Nurses Association. We know that many of our nurses will not disclose any of mental health concerns or during that time. So we were able to develop this program with funding from key organizations, and then we are able to sustain that to this day. they are now looking at, they're not looking at, they now will be launching or have already launched a podcast for the KEWP, that they'll be releasing the first podcast session soon. So this is a service that has been very helpful to our members, particularly in maintaining mental health. Next slide, please. We have our mentoring program. P3 stands for Patnubay sa Pagtatagumpay, or Mentoring for Success. We will be starting cohort 3. If you're not a member of PNAA yet, you still have time to be a member and sign up to be part of this program. So that will start in October 2025. Who knows? I could be your mentor. So we will be assigning you to mentors depending on what your needs are. If you say that you want to be a president of an association, if you want to be a nurse scientist, then potentially I could be your mentor. If you want to be a CNO, that's not me. We'll have to find you another mentor. If you want to be a dean of a school of nursing, that's not me either. But we'll find you another mentor. But that's how this program works. That is available and free to our members. Next slide, please. I'm going to try to finish this soon, so we'll have time for questions. This is another. This is one of the programs that I'm very proud of. First, I would like to say that we do have permission from these students to share their photos and their stories. These are 6 individuals from the Philippines who will be receiving a scholarship, an academic scholarship from the Philippine Nurses Association of America. And this scholarship is not a one-time donation. We will be supporting them for 4 years throughout their nursing program. So they're the first cohort of the Philippine Nursing Scholarship Program task force. And we will continue to invite applications. If you know of students, this is mostly a need-based scholarship, and we've partnered with state universities in the Philippines. Those of you who know, state universities in the Philippines have free tuition, but the scholarship that the students will get will be support in terms of finances that will be in addition to their tuition. So I heard that they have to pay for related learning experiences so that they could have clinical rotations in hospitals. PNAA will cover that. We will have some extra support for books or whatever supplies that they'll need. Uh, Very proud of this program, of this work of PNAA. Next slide, please. And then research, right? We received $43,000 from the Pharmaceutical Association, Research Manufacturers of America, to examine individual and healthcare provider barriers to depression screening. I know you can see a QR code here. This is a QR code for nurse practitioners who are seeing patients of Philippine descent who are 65 or older. If there are any of you in the audience, feel free to take the survey. But you have to be a nurse practitioner. You have to have seen Filipinos in your practice, and they have to be over the age of 65. So if you meet any of those criteria, you can take the survey. But that's research funded by pharma. So we're working with big pharma here in the U.S. to help look at barriers in depression screening and diagnosis here in the U.S. Next slide. Uh, we have multiple awards that we hand out every year. The one thing that I want to mention here is the Daisy Award. Daisy is a big organization that hands out these awards. PNAA as the very first ethnic minority nursing association that partnered with Daisy to award the Health Equity Award in 2021. So now other organizations are doing that, but PNAA was first. We're very proud of that work with the Daisy Foundation. Next slide, please. This is just the work of our business development office. If you want PNAA merchandise, we all will have that soon. I'm surprised we don't still have it right now after being here for 4 to 6 years, but there's a lot of asks from our members, so we will definitely make sure that we have that. Just have a couple more slides. I'll probably skip. Uh, I mentioned earlier my mantra, which is impact and influence. and then we can just skip this. So we are looking at the actions that we do that produce the impacts and the results in the community. So this is just an example. I'm not going to go through that. But these are some of the things that PNAA, our committees, our task forces, and our chapters do for local communities and the national and global communities. Next slide, please. You could just skip to next slide. Yep. So as I've said earlier, PNAA founded 1979. We just celebrated our fourth, sixth year in Detroit. Yes, there's a lot more work to be done, but looking back and looking forward, uh, we've gone a long way. And then if you have read this book, The Boy, the Mole, the Fox, and the Horse by Charlie Maxey, uh, I'll just read. We have such a long way to go, sighed the boy. Yes, but look how far we've come, said the horse. So I always remind our members, our leaders in PNAA, of how much work PNAA has done. And I'm really looking forward to welcoming you if you are not a member of PNAA yet, or listening to your concerns, your needs, so that PNAA can address and be of value to you. I'll end right there, Ron,
All
and
right.
open it up for questions.
All right, Marlon, that was just fantastic presentation. Thank you. I learned a lot about the scope of the many, many different activities that PNAA is involved in. So thank you for sharing that. Marlon, a couple of questions that come to mind here. We have some guests joining this presentation who are not from the Philippines. They are
Mhm.
from other countries. Can you just speak briefly to how the PNAA may interact with individuals from other countries?
Absolutely. So first, I don't want to just sound like come be a member of PNAA, but you can be a member of PNAA even if you're not Filipino. That's one of the initiatives that we started to make sure that not only are we practicing what we preach in terms of diversity and inclusion, you just have to support the mission of PNAA, and which is practically helping the community. Uh, and you have to love rice. I'm kidding. Because you'll see a lot of that. You'll be eating a lot of food at our events.
Yeah.
If you love food, if you love family, come join us.
Okay. Awesome. Awesome.
Yes.
So
Also, we
that's
can
great.
connect them with our other partner organizations. So, like I said earlier,
Okay.
we are an organizational affiliate with ANA. We work closely with the National Association of Native American, the Indian nurses, Korean nurses. Some of our chapters have joint meetings with them. Uh, the Black Nurses Association, Hispanic Nurses Association. So let us know how we can be of service to you, and we can make that happen.
Great. Marlon, for a nurse that maybe has arrived in the US recently, let's say in the last 3 or 6 months, what is the best way for them to get connected with PNAA to learn more about it and to, join and participate in the various activities?
All right, thanks, Ron. So I will connect them with the chapters, and then you can find out about the chapters by going to our website. It's mypnaa.org, mypnaa.org.
Yeah.
Uh, if you find it burdensome to look for the chapters, just contact us. And there's one email on there. Just shoot an email. Tell us where you're from, and we will connect you with the local chapter. So that you can experience that PNAA, local PNAA experience locally.
Yeah. Great. Marlon, I know from our perspective and our experience, the Worldwide Health Staff team has had the opportunity and privilege of connecting directly with several numerous of the chapters. Just maybe give our guests an overview and some insights into some of the things that local chapters are doing to help support
Right.
Filipino nurses generally in that geography, and particularly those that may have arrived most recently?
So before I go to the local chapters, I could tell you about what the national organization is doing and has done.
Okay.
National organization has published a handbook for newly arrived nurses, and in that handbook, you'll have some guides on, what do you need when you first migrate to a country, and if you don't have family members here, how do you open a bank account, getting your social security. Those are the things that are very difficult to navigate when you don't have local connections. So yes, we do have a handbook, but it is always better to connect with a local chapter because they will walk you, hand in hand to do all those things. PNA Metro DC has a big program, Kuya Ate program, where they will
Yeah.
handhold newly arrived nurses to the local area, show you where the Filipino grocery restaurant is. Those things that if you don't have any family members or friends in that local area will be very difficult to find. We do have a Marife Sevilla, who is the chair of our human rights task force, uh, is very actively involved with the embassy and the consulates. PNAA is part of the PDOS, the pre-departure orientation seminar that newly arrived nurses, I guess, they're required to take before they leave the Philippines.
Right.
Uh, and not only will you find PNAA during that seminar, like you can continue to connect with us after that. So there's a lot of things. I mentioned one chapter, but many other chapters are doing the same thing.
Yeah. Excellent. Very good. I know from firsthand experience, working with the chapter in the Washington, D.C. area, that they do an amazing job. And I know that all the nurses that they touch, they certainly benefit from being members there. And as you said, Marlon, many other chapters around the country do very similar things as well. I saw at the outset of your presentation on the map of where there were chapters and where there weren't. The one geography I took note of was Iowa, and I'll follow up. I think there's great opportunity to start a chapter in Iowa.
Yeah,
I know that from our experience that we've landed many nurses there, and there's many more headed to Iowa. So I think that'd be a great place for the next chapter.
absolutely. Let me know. I'll be willing to fly there and jumpstart
Yeah,
that chapter.
yeah. We can. We'll see that happens for sure. Ali, just before we wrap up, thank you for moderating
Yes,
today.
thank you,
Is
Ali.
there Are there any other questions or feedback that may have come in that we can have Marlon address before we wrap up for this presentation?
Nope, no other questions in the chat.
All right, Ali, thank you for keeping us on track here today. Marlon, thank you again so much for your time. Uh, Really great information for those that are joining us live. Please know that you can also you'll be able to find a recording of this presentation on our social media channels on Facebook, Instagram, etc. So if you'd like to share that information or connect, have colleagues connect with this presentation, please feel free to share the various social media links with them as well. Marlon, just before we wrap up today, any last thoughts or comments that you would like to share with our guests?
Uh, I guess that's after everything that I've said. Now I'm a loss for words. Reach out to PNAA. You do have a family here in America. Many of us are continuing to be a member of PNAA, are staying with PNAA because we consider PNAA as our second family. And so, this is a family that contributes to society. So you're welcome to join us. Reach out and don't be a stranger.
All right. Awesome. Well, Marlon, thank you again. Thank you to our guests for joining us. Please stay connected with us on social media. We're always excited to bring these type of informational and educational type of webinar presentations to applicants around the world. And the best way to stay connected with regards to upcoming webinars is just to keep in touch with us on social media. Many of you will be very much looking forward to the forthcoming October 2025 State Department Visa Bulletin. We have a very special webinar planned for late September that will deal with that topic specifically, that I know is of interest to nurses both in process and those nurses considering starting their immigration journey. So please register for that today. We're going to have some great guest presenters also joining me for that presentation, and many others that we're pleased to support on an ongoing basis. Marlon, thank you. Thank you to all of our guests. Until next time, be well, and we'll look